The WHO, the World Health Organization, have realized that surgery is quite a risky business. When you look at surgery on a global scale, there are millions of patients who have operations every year. I think it's an estimated 230 million patients. Of those, about 7 million patients have complications due to their surgery, and probably about 50% of those complications could be avoided. A team of experts at the World Health Organization have got together and looked at the evidence base behind complications that happen during surgery, and they've drawn up a checklist, a 19-point checklist that gives us a structure and a sequence to follow to help us in our care of patients. It formalises what we already do. So these checks we already do, but it makes sure that we all do them at the same time, we do them all together. The checklist looks at critical points in the patient's journey through theatre. So what we do at the start of the day, we have a briefing meeting with all the whole team that's going to be involved in the care of the list that day.
We've got 3 cases on the list at the moment. The first case is a removal of a nus bar for pectus excavatum. The bar was put in 2 years ago. Second case is
we discuss each patient and we find out who's on the team. We decide what we're going to do and in what order, and then think about any specific bits of equipment that we need, any staffing issues, and anything else that's going to upset the flow of work during the day. We're not having to rely on memory, that we have a format to go through, so we're doing the same thing every time for every patient. And it makes the care of our patients safer. This sort of approach is something that's common in high-risk industries, and actually if you think about it, surgery is a high-risk industry. The sign-in is a point at which we check the things that are critical for us to check before the patient goes off to sleep. So obviously that we've got the right patient, and that we've got the right patient for the correct operation.
We have a consent form here, which is for a right pneumonectomy. Do we have an arrow on the right? Cross. A cross. Okay, we'll put that in a second.
Before we anaesthetise the patient, we obviously have to make sure that we've checked the anaesthetic machine, we've got all our drugs ready. If the patient's going to need blood for the operation, it's clearly vital for us to know that that blood is ready and available, so we check that. Another critical point in the patient's journey through theatre is just before we start the operation. So around the table you have the surgeon, you have the scrub nurse, you have the anaesthetist, and all the other members of the team that are involved in the care of that patient for that operation. And we run through again some critical points that we need to check before we start.
Okay, so this is surgical pause. Do you want to read the name?
Zoe Magnus.
Yep.
Hospital number 894928.
Okay, X-rays up. I'll confirm that's the right side. You happy with the side, Mark?
I'm happy with the side. I marked it myself as well.
The surgeon then will talk through what he's going to do.
Surgically, she's got...
Telling the rest of the team, this is what to expect. This is a straightforward procedure, or this is a really complex, really difficult procedure. It's clear and it's obvious that everybody else has the same awareness of what the issues are.
And she had her antibiotics at 10 to 11.
Antibiotics are critical to the safe care of the patient. We know from the evidence that if you want to reduce infections in surgery, you need to give antibiotics within 30 minutes of incision, 30 minutes an hour of the incision. Now it's a time to prompt to say, have you given the antibiotics?
Can we just make sure that we know who everybody else is in the room?
In order to work effectively as a team, you need to know who everybody is in the room. It's very important that we just simply introduce each other, so in that way everybody has a voice and everybody's much more likely to speak up if they don't understand something, if they see something that's not quite right. They're much more likely to help out and help each other to look after that patient. The surgical safety checklist has given us a structure to work through, given us a system so that every patient that comes to theatre, the same critical points are addressed in their journey through theatre. At the end of the operation, again, another critical point, it's a time for the sign-out. It's a time for the team to just confirm that they've done the procedure that they had intended, that they haven't changed the plan for some reason, that the specimens, if they've been taken, they've been labelled correctly. This is clearly vital to the patient. If there's a biopsy taken, for instance, it's vital that it's labelled correctly with the patient's name, that the nurse at that time also confirms that the swabs, needles and instruments are correct, and then to think about any equipment issues that need to be addressed. Obviously a piece of equipment is not functioning properly, it's important to address it, to deal with it, not to recycle it. And then the doctor, the nurse and the anaesthetist can discuss what to do next. Is this a routine operation? Patient's going to go back back to the ward and follow the routine course, or is there something specific we need to think about, continuing antibiotics or intravenous fluids? And that's the time for us to address this as a team. The surgical safety checklist is something I would definitely recommend to other hospitals. It just improves the way that we work together as a team. At the end of the day you think, gosh, we've done a good job. And why have we done a good job? Because we've all been pulling together. If there have been any issues, we've been able to solve them before they become a crisis.